Welcome everyone, the channel dedicated to helping you protect your heart health. Have you ever wondered if the medications you take daily are silently increasing your risk of a heart attack? In this crucial video, we'll uncover 6 common drugs that could be jeopardizing your heart health without you even realizing it. Understanding these hidden dangers is vital for making informed decisions about your well-being. If you're committed to safeguarding your health, don't forget to subscribe and click the notification bell. By doing so, you'll stay updated with our latest insights and tips to keep your heart in top condition. 1. Hormonal contraceptives. Important note: the information in this section is for general reference only and is not a substitute for professional medical advice. The use of any medication or choice of contraceptive method must always be discussed and decided with your doctor, who will assess your individual health status and risk factors. Hormonal contraceptives have been instrumental in providing women with effective means of family planning and reproductive autonomy. While mainly concerning women of childbearing age, understanding these risks can also give you a broader perspective on how medications can affect the body and perhaps help you share information with your children or grandchildren. Combined hormonal contraceptives, CHCs, which include both estrogen and progestin, are available in various forms, such as pills, patches, and vaginal rings. Research indicates that CHCs can elevate the risk of arterial thrombotic events, including myocardial infarction, heart attack, and ischemic stroke. A comprehensive study involving over 2 million Danish women aged 15 to 49 observed that users of estrogen-progestin combination pills experienced a 2-fold increase in the risk of these events. Specifically, this translates to 1 additional stroke per 4,660 women, and 1 additional heart attack per 10,000 women annually. Notably, non-oral CHCs demonstrated even higher risks. For instance, vaginal rings were associated with a 3.8-fold increase in heart attack risk. The underlying mechanism is believed to involve estrogen's influence on coagulation pathways, leading to a prothrombotic state. Estrogen can enhance the synthesis of clotting factors, thereby increasing the likelihood of thrombus formation. This effect is particularly concerning for women with additional risk factors, such as smoking, high blood pressure, or high cholesterol. Therefore, a detailed discussion with your doctor is extremely important to assess individual risk factors before choosing or continuing any contraceptive method. Progestin-only contraceptives available as pills, injections, implants, or intrauterine devices. IUDs generally present a lower cardiovascular risk profile compared to CHCs. The same Danish study highlighted that progestin-only methods were associated with a slightly elevated risk, but significantly less so than their estrogen-containing counterparts. Importantly, the progestin-only IUD did not show an increased risk of heart attack or stroke, making it a safer option for women concerned about cardiovascular complications. The choice of contraceptive method should be thoroughly discussed with a doctor. 2. Non-steroidal anti-inflammatory drugs. NSAIDs. Please remember that all information here is for educational purposes only and does not replace medical advice. The use of any medication, even over-the-counter ones, requires guidance from a healthcare professional. Always discuss with your doctor or pharmacist before taking NSAIDs. Non-steroidal anti-inflammatory drugs. NSAIDs are widely used to alleviate pain, reduce inflammation, and lower fevers. Common over-the-counter NSAIDs include ibuprofen and naproxen. While effective, these medications have been associated with an increased risk of cardiovascular events such as heart attacks and strokes. NSAIDs exert their effects by inhibiting cyclooxygenase COX enzymes, specifically COX-1 and COX-2, which play crucial roles in the production of prostaglandins, lipid compounds that mediate inflammation and maintain various physiological functions. Inhibition of these enzymes can disrupt the balance between vasoconstriction, narrowing of blood vessels, and vasodilation, widening of blood vessels, as well as platelet aggregation, blood clotting, leading to an increased risk of thrombotic events. This imbalance is particularly concerning in individuals with existing cardiovascular conditions. Numerous studies have highlighted the cardiovascular risks associated with NSAID use. The U.S. Food and Drug Administration (FDA) has emphasized that the risk of heart attack or stroke can occur as early as the first weeks of NSAID use, and this risk may increase with longer use and higher doses. Importantly, This risk applies to both over-the-counter and prescription NSAIDs. A comprehensive review published in the European Cardiology Review examined the cardiovascular implications of both traditional NSAIDs and COX-2 selective inhibitors, COX-IBs. The review underscored that NSAID-induced cardiovascular side effects have been overlooked for many years, leading to increased awareness of their potential risks. Not all NSAIDs carry the same level of cardiovascular risk. For instance, diclofenac has been associated with a higher risk of major vascular events, including heart attacks, compared to other NSAIDs. Conversely, naproxen appears to have a more favorable cardiovascular risk profile among NSAIDs. Given the potential cardiovascular risks, it is essential to use NSAIDs judiciously. Before using an NSAID, it is extremely important that you thoroughly discuss your cardiovascular history and risk factors with your doctor or pharmacist. They are the best people to advise you on the lowest dose and shortest duration of use that is right for you. You should also regularly monitor your blood pressure and watch for signs of heart-related side effects, especially if you use NSAIDs long-term. For patients with high cardiovascular risk, explore alternative pain management strategies with your doctor that pose less risk. Always consult your doctor or pharmacist before use. 3. Thiazolidinedione. Diabetes medications, such as rosiglitazone. Before considering any information about prescription medications, please note that this is general knowledge and not personalized medical advice. All decisions regarding your diabetes treatment must always be made in consultation with your doctor. Rosiglitazone was designed to improve blood sugar control in individuals with type 2 diabetes mellitus by enhancing insulin sensitivity. However, concerns regarding its cardiovascular safety have significantly impacted its clinical use and regulatory status. Rosiglitazone functions as a peroxisome proliferator activated receptor gamma PPAR gamma agonist. Activation of PPAR gamma influences the transcription of genes involved in glucose and lipid metabolism, leading to increased insulin sensitivity in peripheral tissues. While this mechanism effectively lowers blood glucose levels, it also affects fluid balance and lipid profiles, which may have implications for cardiovascular health. The cardiovascular safety of rosiglitazone has been a subject of extensive research and debate. A meta-analysis published in the New England Journal of Medicine in 2007 indicated a 43% increase in the risk of myocardial infarction among patients using rosiglitazone. Multiple studies have consistently shown that rosiglitazone is associated with an increased risk of heart failure. A comprehensive meta-analysis concluded that while there was no significant increase in myocardial infarction or cardiovascular mortality, the risk of heart failure was notably higher. Observational studies have yielded mixed results regarding the association between rosiglitazone and stroke, or all-cause mortality. Some analyses suggest an elevated risk while others do not find a statistically significant increase. The controversy surrounding rosiglitazone underscores the importance of vigilant post-marketing surveillance and comprehensive evaluation of drug safety profiles. Clinicians must weigh the benefits of blood sugar control against potential cardiovascular risks when considering thiazolidinediones for diabetes management. In some cases, alternative medications with more favorable cardiovascular safety profiles may be considered by your doctor, especially for patients with existing cardiovascular disease or risk factors. Your doctor will make this decision based on your health situation. You should discuss thoroughly with your doctor to weigh the benefits and risks and to find the most suitable treatment option for your cardiovascular health. 4. Certain antidepressants. Please note this information is for educational purposes and does not replace personalized medical consultation. Always discuss any concerns regarding antidepressants, as well as any changes to your treatment plan with your doctor. Tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, are widely used to manage depressive disorders. While effective, both classes have been associated with potential cardiovascular side effects, which are important to consider when prescribing these medications. Tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline function by inhibiting the reuptake of neurotransmitters like norepinephrine and serotonin, thereby enhancing mood. However, their pharmacological profile affects various cardiac parameters. TCAs can cause a significant drop in blood pressure upon standing, leading to dizziness and an increased risk of falls. This effect is primarily due to their antagonism of alpha-adrenergic receptors. These medications may prolong cardiac conduction evident in increased PRQRS and QT intervals on an electrocardiogram ECG. Such changes can predispose patients to arrhythmias, irregular heartbeats, including ventricular tachycardia and fibrillation. TCAs often cause tachycardia, rapid heartbeat, due to their anticholinergic effects, which can be problematic especially in patients with pre-existing heart conditions. Given these potential adverse effects, caution is advised when prescribing TCAs to individuals with cardiovascular disease. Your doctor may consider more suitable alternative treatments for these individuals depending on your specific health condition and medical history. Selective serotonin reuptake inhibitors, SSRIs including fluoxetine and sertraline, selectively inhibit the reuptake of serotonin, leading to mood improvement. They are generally considered to have a more favorable cardiovascular profile compared to TCAs. Some SSRIs, notably citalopram and escitalopram, have been associated with dose-dependent QT interval prolongation, which can increase the risk of a rare but serious arrhythmia known as torsades de pointes. Consequently, the FDA recommends limiting the maximum daily dose of citalopram to reduce this risk. While less common than with TCAs, SSRIs can occasionally cause orthostatic hypotension, a drop in blood pressure when standing up, and a slow heart rate. These effects are generally mild, but warrant monitoring, especially in patients with existing cardiovascular concerns. Overall, SSRIs are often preferred over TCAs for patients with depression who have concurrent cardiovascular disease due to their more favorable side effect profile. However, individual risk factors and potential drug interactions should always be considered by your doctor. You should always trust and talk to your doctor about your health history to get advice on the most suitable medication. 5. Pseudoephedrine. Please note, this information is for general education. Always consult your doctor or pharmacist before using any medication, including over-the-counter cold or allergy medicines, especially if you have a history of heart disease. Pseudoephedrine, a common decongestant in many over-the-counter cold and allergy medications, is effective at relieving nasal congestion. But it also has potential cardiovascular effects, especially for people with heart disease. Pseudoephedrine works by stimulating alpha-adrenergic receptors, leading to the constriction of blood vessels in the nasal passages. This vasoconstriction reduces swelling and allows for easier breathing. However, this effect is not limited to the nasal tissues. Pseudoephedrine can cause vasoconstriction throughout the body, potentially impacting cardiovascular function. Pseudoephedrine can elevate blood pressure and heart rate due to its systemic vasoconstrictive properties. Studies have shown that in patients with controlled hypertension, pseudoephedrine may cause a modest increase in systolic blood pressure. There have been reports linking pseudoephedrine use to acute coronary syndromes such as heart attacks. The drug's sympathomimetic effects can increase myocardial oxygen demand, the heart's need for oxygen, potentially triggering cardiac events, especially in susceptible individuals. Pseudoephedrine may induce arrhythmias, irregular heartbeats including tachycardia, rapid heartbeat. These effects are particularly concerning in individuals with underlying heart conditions or those taking other medications that affect heart rhythm. Individuals with existing cardiovascular conditions such as high blood pressure or arrhythmias should consult their healthcare provider before using medications containing pseudoephedrine. If you have a history of heart disease, your doctor or pharmacist may recommend alternative treatment options with a more favorable cardiovascular profile, depending on your specific condition. Even in healthy individuals, you should monitor your blood pressure and heart rate when taking pseudoephedrine, especially if used in higher doses or for extended periods. Pseudoephedrine can interact with other medications such as monoamine oxidase, inhibitors, MAOIs, and beta blockers, potentially making cardiovascular effects worse. Informing healthcare providers of all medications being taken is essential to avoid adverse interactions. Always consult your doctor or pharmacist before using cold or allergy medications, especially if you have a history of heart disease. If you found this video helpful, please remember to hit the like button. It really helps us bring you more valuable content. Drop a comment below and let us know your thoughts, questions, or what topic you'd like us to cover next. We love hearing from you. Of course, hit the subscribe button and turn on notifications so you never miss out on our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.